Segun sa wagway, Robert Arihote Bonspiel, Yunjats, the no Kanesatake, the Sutariha, Latinigurare, Yunjaradakwa. I was see a guay so the garide. Hello everyone, my name is Robert Arihote Bonspiel and I'm the spokesperson for your Kanesatake Emergency Response Unit. I hope you are all well. Today we're going to be talking about something that's really important to everybody, the vaccination. We're in the throes of the clinic right now, so we're going to be talking to somebody who knows what they're talking about, a frontline worker, a nurse who is implicated right in the COVID-19 struggle. First, before we go any further, you might hear some noises behind you. You might hear a little bit of, like right now, the telephone's going, and that's not the end of the world. We're kind of in the middle of a war here. We've got a lot of work to do. We got a lot of community members that are coming through for the KHC for vaccination. But this is directly in regards to vaccination. We want you guys to understand what's going on. And actually, I think this is a good backdrop. You can hear how busy the ERU is, trying to keep to make sure that everybody remains safe and healthy. So we've got telephone coming in. We've got people talking in the back room. We've got appointments being made. And Anne and I here trying to talk to the camera and talk to you about how important it is to get vaccinated. So my guest today is Anne Richard. Anne Richard is a community member. A lot of people know her. And if you don't, I don't know where you've been, because Anne's been here forever, just as long as I have. I've known Anne for my entire life, and Anne decided to go into the medical field, and now she has been working. So Anne, could you tell me, I know you're a clinician, can you tell me exactly where you're working?
I'm working at the Jewish General Hospital in Montreal in cardiology and cardiac surgery. It's one big unit. We have the cardiovascular intensive care unit and the cardiology side, where patients come in for angioplasty, pre and post CABG for patients that have heart problems. I've been there for 17 years.
So 17 years you've been a nurse. I'm sure you've seen a lot of stuff.
Yeah.
Okay. In the past 17 years, or in the past year, what has been different in regards to how the patients are coming in or what you're seeing?
I think during the first wave of the COVID-19, mainly people like the intensivists, the ER doctors, the nurses, the PVs, everybody were more focused on the COVID. Okay, but then afterwards it came in that patients were not just coming in with COVID. We forgot about our cancer patients or cardiac patients that were coming in with CHF, they're coming in with chest pain, they're coming in with a whole bunch of problems. Diabetes not being controlled properly. And those patients were being neglected because of COVID.
Okay, so you're saying you had your regular workload that was still there plus the COVID-19.
Yeah, so it just made it even harder because of the strict measures. We have to go in, the security is there when you go in. They ask you where you're going, are you working here? If you have an appointment, they have to guide you by the security. And everybody's been checked.
Okay, so I would assume that's made your job a lot harder, right?
A lot harder. It's more tiring because everybody was being isolated. Like even patients coming in from emergency, they have to be swabbed for COVID. They can't come on a unit without having that result out, or either positive or negative.
Okay, so you're having and up and above the normal problems that you're having, all patients have to be swabbed and make sure that they don't have COVID-19 before coming into a ward.
Yeah.
Can you tell me how many hours? I know that nurses are working a lot of hours these days. Can you talk to us? I know how it works in regards to TSO and things like that. Did you let the population know what that means exactly?
Well, the TSO means you're forced to do overtime. But in our hospital, the Jewish, we don't have that policy unless we are really, really stuck. We don't have anybody, then somebody will have to stay.
Okay. You're seeing a lot of patients that are coming in that are COVID positive, as well as your regular type of patients. I'm not taking away from the severity of their situation, but the regular type of patients that you would normally see. What are some of the signs, and what are you seeing in these people? Like what is happening with them?
Well, some of the patients that did came in with COVID, sometimes the symptoms didn't even have a fever. They would have, sometimes we complain about body aches, but most of the time it would be just a simple cough, which we had a patient a month ago was having a cough. She was a 93-year-old lady, frail, with CHF, and the cough never went away. We check her temperature, everything. Nothing would show. The chest X-ray didn't show anything. And finally, we decided we're going to do a COVID swab on her because there's something going on. And sure enough, she was COVID positive, and I was in contact with that patient.
Okay, and for those of you who don't know, CHF is chronic heart failure. So I guess so you're getting situations where it looks like it's not dangerous, but it ends up possibly being dangerous to you, the individual, the nurse, or the doctor, or any other medical staff.
So everybody was like panicking because we don't know what was going on. And then everybody had to get swabbed. I had to get swabbed. All the staff that were in contact had to be contacted to the COVID clinic that we have at the hospital. So we had to get tested. So only one person ended up being positive because of that patient.
Okay, well that's good news. Sad for that patient, however, good news for the rest of the staff.
In the end, we found out that the patient died of COVID.
See, there you go. I know that we're a lot of people, I think, Kanesatake or some of the community members believe that this only affects older people or people with very serious underlying medical conditions. I know that you've seen like some horror stories, and without getting too graphic for our viewers, can you tell me some of the stuff that you've seen, some of the stuff that's not normal, some of the stuff that we don't expect to happen?
Well, like with the COVID virus, what I've seen is that it comes in severity. Like some elderly could come out of the COVID very fine, and others will be like very sick. They will end up in the ICU, intubated, and having central nerves coming out of everywhere. And others will come out of it very fine. They'll have some side effects from it, like they'll be more tired, and it's going to linger for a very long time, and that's normal. That's what's expected.
Okay.
It's going to take time, but eventually they'll get back to normal.
May I ask, what's the youngest patient that you've seen?
The youngest patient that I've heard, who was not on my unit, but I know was in our hospital, I think was a 25-year-old or 35-year-old when traveling to Mexico.
Okay, so went to Mexico.
Full-blown COVID.
Okay, and what can you tell me a little bit about what its signs, symptoms? What was going on? What required him to go to the hospital?
Well, he started having a fever, started not feeling well, kind of like a flu-like symptom type of thing. So he went get tested in the emergency because it was an emergency when he arrived. So and then they tested him. He was positive.
And I would assume that he was able to go home relatively quickly, or was he in the hospital?
He's still in the hospital.
He's still in the hospital. Yeah. How long ago was that?
I believe it was maybe a month or 2 months ago.
So even up to 2 months ago. So 2 months, 8 weeks he's been in the hospital. And he's 25 years of age.
Because he came in with shortness of breath, and he started having body aches and started having a bit of fever. So that's when he came to the emergency, and then the whole thing started.
Okay, and it just kept gradually getting worse.
Yeah, his lungs were not functioning well. His heart was not functioning well. So basically, it's just major organs were just completely
shutting down, not working properly.
From what I know, he was very weak. He was not able to walk after 8 weeks. Just 1 week being in bed, it makes you weaker for almost a month. Especially with the elderly, they're the ones that get weaker faster. In this case, it's like starting to mobilize, but it's taking longer because he's been in bed for 8 weeks. So it's taking him a long road for him ahead, especially for just walking. He has to do it every single day. The physiotherapist and the occupational therapists are working with him every single day to get him stronger. But his heart is still weak. So
his lung capacity, his heart capacity, and obviously his muscles were affected by COVID-19.
Yeah.
At the time. Did he have any respiratory issues where he needed oxygen or needed anything else during this time that he was in the hospital?
At the beginning, they had put him on oxygen because he was desatting when he came in. So then that's when the whole thing started. So he was getting his lungs were getting weaker.
Okay. At any point, did they have to do anything else to help him breathe?
But then after that was just the intubation. So basically, he was on ventilator for a while, and then they was able to extubate him. He was doing better after, but he's still requiring a bit of oxygen.
Okay, so he was intubated. So you were assisting him with his respiration.
Yeah.
Okay, thank you. How long do you think it will take before he comes back to being normal, to the way he was before COVID-19?
To be before COVID-19, it's going to take maybe months.
Months.
Depends on how well he's able to do his, like for his heart, it's probably going to be taking longer because his heart got affected and the lungs. So those are the organs that are going to take longer to recuperate.
Yeah,
if there's no permanent damage.
And if there's permanent damage, he can look forward to a life that's
Yeah.
not as
Just
good as what he
It will
had.
be with medical treatment.
Okay. I know that a lot of people are talking about how we can prevent it, and obviously one of the ways to prevent it is to keep washing our hands and to wear a mask and to social distancing, like you and I are doing right now. But now that Kanesatake has the availability, the possibility of vaccines, what would you say to people who are worried about vaccine? Is knowing what you know.
I think the vaccine is a good thing because this is going to help to bring down the numbers of positive COVID-19. And the vaccine actually it's going to help you build antibodies against the virus. This is what people don't understand. They think they're going to get COVID because of the vaccine. No. What your body is doing is creating protein. It's a protein, it's basically our DNA, the RNA. So this is a protein that you're going to build inside your body once you get the vaccine. And this is going to create antibodies against the virus to protect you not to get COVID. But if some people have gotten it because of the vaccine, but the symptoms were less harder on their body.
So in other words, you can still possibly, I guess it's within a time frame that you can still contract.
They still don't know the exact effects of it. They're still studying it, but so far it's been positive.
Okay.
But the vaccine is the only thing that's going to get us away from this mask.
Right now, there's been a lot of talk in the media about what the percentage of the occupation of hospitals are. Like you'll take a look at the emergency rooms that are at 175% capacity and the like. Do you believe the vaccine would have an incidence on bringing that number down?
I think it would help. So far, the ICU is starting, numbers are going down, the less patients, and more patients are recovering. So I think the vaccine is going to help us to get through this.
Perfect. Thank you very much. Do you have anything to add? Like anything that you think would be important for people in Kanesatake to know, so they can understand? Would you get vaccinated? Have you been vaccinated?
I got vaccinated from the first day that started. That we got vaccinated. We were one of the first ones to get it.
Okay. And would you, if you had to make that decision again, and if you had to tell somebody that you love whether or not to get vaccinated, what would you suggest that they do?
I would suggest they get vaccinated, especially our elderly are the ones that they get hit the hardest. And I think that's important for all of our community to get vaccinated as much as possible so we can go back to our normal life without having our mask on.
Thank you very much. Thank you very much to Anne Richard. Thank you very much to you guys for listening. It's always fun and very interesting and educational to talk to people that have something to do directly with COVID-19. We spoke to David Gabriel, who was a victim of COVID-19, is still suffering some ill effects. We're speaking with Anne now. She's giving us some insight into what a day is like in the hospital with COVID-19 patients. So, Nyawago, thank you very much. Merci beaucoup, Anne. And please stay safe, guys. Go get vaccinated. We're still here. We're still going to be taking information, 514-467-8059. If you have to get in touch with us here at the ERU and you want to register for the vaccination, we'll call you back at a later date to give you an appointment. But we believe that it's really important that we give this a chance. There's a heck of a lot more advantages to being vaccinated than there is to catching COVID-19. Thanks, guys. Have a great day. We'll talk soon.